So thank you for attending our Newham webinar today. So we're going to go through who the CEG are. So we're a non-profit organisation. We've got GPs, analysts, scientists and facilitators, and we're based at Queen Mary University. We also have access to primary care data across NIL, and we build dashboard searches and software commissioned by the NHS. So when we're using primary care data for improving population health, we support high quality data entry. We build dashboard searches and software tools like our APL tools, and we support 272 practices across North East London with a facilitator for each place. So the aims and objectives of this webinar will be, we'll look at the local services and any updates, top tips for improving practice income. We'll also be going through our CEG APL tools and what's available to the practices, CEG resources, and there'll be a section there for you to have your say, so what you would like from us. So if you could have a think about that before we get to the end, there will be a section there for you. So these are currently your local services. So you've got your AF, you have your case finding, which includes your AF and COPD. You've got your advanced care planning, COPD, ECGs, latent TB, LTC reviews, which is your diabetes, CVD reviews. You have your mental health, primary prevention and CKD, wound care, and for public health, you have your NHS health checks and sexual health. Just to make you aware, with the SNSs now, it's the ICB that give us the figures for the ECGs, MDTs and care plans. So whenever you get your SNS invoicing tools, please be aware if any of them figures don't match, then it is the ICB that you would need to discuss that with. You also have your incorporated SNSs. So these are your diabetes, your anxiety and depression, epilepsy, frailty care reviews, infant feeding, CKD management, childhood asthma reviews, and early identification and advanced care planning. So the service that's been removed from this SNS this year is the ADHD review for adults. That has been removed. So now I'm going to run through. So there are two new services that will be coming, one that's been updated and one that's new. So this is the T2-day program. So this will be coming soon. This is for those patients with type 2 diabetic, aged 18 to 39, and they will be offered an additional appointment with their 9 care processes, and it should be roughly 3 months apart. As I say, this is very new. You haven't been informed about this one yet, but these are the basis what they're looking at. It will be an additional appointment to look at diabetes wellbeing questionnaires, assessment of social needs, diabetes control. So these are just some examples, and if they've got well enough education about weight management. We will be supporting these with a template and also support searches. And once this is available, we'll let you know via the bulletin. Does anyone have any questions around this at all? Rishma?
No questions in the chat.
Okay. We've also got the BBV screening, so the blood-borne virus screening. This will be replacing the HIV screening. So the tests include HIV, Hep B, Hep C and syphilis for these. This should be offered to all new patients aged 16 to 64, registered from the 1st of October. They should complete a TQuest form, picking the BBV screening, and if the patients are already positive for either of the tests, then these tests needs to be unticked on the TQuest form before sending. So if the patient's already HIV positive, you will just remove the HIV positive HIV test from the TQuest. So I'm just going to show you the TQuest form. So here you've got your select your test groups. You would select the Newham BBV screen. And as I mentioned, the 4 tests are here. So for HIV, if the patient is HIV positive, you would highlight the HIV antibody and then select remove from this test before sending, because they are still entitled to have the other tests as well. And there will be a section informing you on the template as well if they are positive, so you know to remove it. Is there any questions regarding the BBV screening at all?
Hi, Billy. Just sorry.
Oh, yeah.
Good afternoon. My camera is not working. I think it's disabled. It's showing. I will sort it out. So I do not have any questions regarding BBB, but previous one I have a question regarding diabetes list. I think that one is leading by LMC chair Tamara. So do you know when it will be introduced? Is it from the 1st of April next year, or this is it from this year?
Supposed to be going, sorry, it's Jane. Hi, everybody. It's
Hi,
supposed to be
Jane.
going live on the 1st of December, and I've got a meeting with Tammy and all of the people after this webinar to discuss it to see when it's going to go live, but we're hoping for the 1st of December, so this week. So we have got everything ready, searches, templates and everything, and we'll probably just get the spec signed off today and it'll be sent out to practices. Is that okay?
So thank you, Jane. This is a really good update. Just want to make sure probably you are doing, as Tammy said, that you are doing the searches and templates and all these things. Do we need the dietitian to do it for the diet advice for this group, or the practice nurse or the GP or the allied healthcare professional ARR staff can do this part? Just a question to Jane.
Yeah, so you can do it in-house unless you feel the need referring to a dietitian, and then you just refer them as normal. So it's basically looking at more like the social needs, so like the wider determinants. So can they understand like the health issues that they've got and things like that? And it's just to do like a mop-up of any care processes that they've missed. And it can be done by a nurse. It doesn't need to be a GP.
Thank you, Jane. It's brilliant. Thank you.
Okay.
And there will be a page on the LTC template that will be diabetes extended consultation, so it will be separate from the diabetes review as well.
Thank you.
Any other questions?
Manager. No, not for me. Thank you.
Someone's asked to go back to the previous slide in the chat.
This one?
Eileen, you had any question about this slide, please?
No question. Thank you.
Yeah, you can move on, Billy.
Now we're going to move on to the top tips for improving practice income through the SNSs. So as you know, the 8 care processes review can be done anytime within the year now. There used to be quite a few that you had to have on the same day, but it can be done within the year. Just to make you aware, referral to IAP programme, the name has changed within the SNOMED code. So now it's referral to improving. It won't show if you type in referral to IAPT, which I had a practice previously that we spoke about this. The LTBI, just a reminder, you can send SMSs and telephone invites as well as letters, as long as you record as letters on the template. Medication reviews, all should be done within the year and should be done on the medication screen. Another little reminder, only give smoking advice to current smokers, CKD patients with evidence of CKD and no cough codes. So these patients should be reviewed and then coded accordingly with CKD stage 3 to 5. We also have our prevalence improvement searches, so please be aware. I'm going to show you shortly these searches, but they do help as well for patients that should be on your registers, and to look at what sort of medication they're on and if they should already be on any of your registers. And then we also have our recall searches, which within that you have Accurex reports, which you can export and just put into your Accurex and send the SMS messages. Like I say, I will go over them for you as well. So recently there was a new service. It was a data accreditation and improvement that came out. We've recently done phase 1. You can still put in your phase 1 if you have signed up for this, and that is to show us proof of your changes to your consultation types and job roles. We did send out a fact file for these, and it does tell you what ones we recommend. So if you haven't done that, please do send me a screenshot of both of them. And now recently we've put out phase 2. So this is looking more at the wider determinants of health. So we've put a page in all of our templates, updated them, and now it will be for phase 2. There's also support searches that looks at patients that are in deprived areas, and this should be offered to everyone that's registered from the 1st of October. And then phase 3 is obviously a visit at the end of the year too. So this is a process where you get paid for what you do. So there's no penalty. So each phase that you do, you will get the payment for them. And I'm just going to do a live demo for you of the EMIS searches. My EMIS up. Can everyone see my EMIS searches?
Yes, we can see. Thank you.
Yes, I'm just going to go through. So obviously you have your ICB contracts in here. You can find out how am I doing. So you've got your 1.5. So please make sure that you have copied over the 1.5. It was in last week's e-bulletin. And here, obviously, you have your payments, and under each payment, you will have the PCN target and the tariff for each one. Also, remember about your missing criteria that we provide. Obviously, I can't show you this report because it's hidden on our end. But please do use these and export them to CSV and put filters if you need to. Obviously, look at the ones that are only missing one. So it might just be smoking status, or it could be BMI. So then you can get your quick wins on them parts. These are your SNS recall searches for Accurex. So there are a few in here, like I mentioned, that have the AccuBook already there for you. So you can just export this as CSV and then import it into your Accurex to send a text message for those patients. You have your incorporated SNSs. Again, it does tell you here the bands and the tariff. Please do always keep an eye on them. Your wider determinants of health, like I mentioned, there are support searches here. You have your target cohort, which is the deprived areas here. And also your newly registered from the 1st of October. So these we did send out an Accurex Florey that is available for you as well, that come out in our e-bulletin, along with the fact file for these. You've got your public health, you have your PCN contracts. So in here, you've got your IIF guidance, which obviously is a lot smaller this year compared to previous year, but do keep an eye on these as well. You've got your SMI physical health checks. Again, here we've put your missing criterias. So please do make sure the national percentage is 70%. And we do have a dashboard on our website as well that you can have a look at to see where your practice or PCN are. In our QOF, we do have some useful searches in our QOF folder. As I mentioned earlier, we have our prevalence improvement searches. I'm just going to show you briefly one of them, which is your asthma prevalence. So the top one looks at patients that are on ICS inhaler on repeat, but are not on the asthma and COPD register. So obviously it would be to review these patients by a clinician and see if they should be on either of these registers. And each folder is different. So for cancer prevalence, it looks at those that are using a non-QOF code. So obviously you could be doing the work, but they're not actually on your QOF register if they're using a non-QOF code. And there are all the QOF areas registers are on here as well. There is also a obesity one that looks at patients that have had a weight in the last 12 months but no BMI. And we recently added in a QOF depression support search. So this recall one is looking at, so obviously you know it's a tight time frame for depression. So we've done some support searches that will tell you how many days you have left to action them. So obviously the top one is you've still got 56 days, 14 days, needs to be done within the last month. So you've got your support searches there for you. Are there any questions about your support searches at all?
So we had one question, not around the support searches, but more around how to sign up for the data accreditation. Yeah, Ash has asked how she'd like to sign up, to know how to sign up for the data accreditation work.
It was quite a while ago that the sign up has ended now. If you haven't already signed up, I don't believe you still can. I mean, I can look into that for you, but it was in March that ended for the sign up. But I can double check that for you. Are there any other questions?
No other questions?
Okay, I'm just going to put the presentation back up for you. Bear with me one moment. Hi, can you see the CEG resources live demo?
We can see the slide, yeah.
Yeah, just the one slide, yeah?
Mhm.
Okay. So now I'm going to pass over to Karishma, who's going to go through the APL tools for you.
Lovely. Just take over control. Okay. Hi everyone, I'm Karishma. For the next part of this webinar, I'll be talking to you, or rather giving you a brief on our existing APL tools. Please note that we have got more detailed webinars on this tool, and in case you've not attended for those webinars, a recording of this is available on our website, and we'll share the link for that at the end of the presentation with you. Next slide, please. So at the moment, we've got 4 active APL tools that are available for you to use. We've got the Cancer Diagnosis Audit tool that was released part of the CEG Cancer Toolkit program project at the last year, and the purpose of this tool was for you to be able to review your patients that were recently diagnosed with cancer and see where you can improve. The second one is the National Diabetes Prevention Program tool that you can use to easily view your patients who are eligible for referral and those who have been referred on to the program. The third one is the renal tool that you probably know as the falling EGFR tool before. And this particular tool is to help you with the management of patients with CKD, chronic kidney disease. And the last but not the least, or our last, is the child immunization call and recall tool that allows you to see registered children with your practice with incomplete or overdue set of immunization that you are to recall or call for the first instant. Lovely. So the Cancer Diagnosis Audit tool is part of the service requirement for your early cancer diagnosis piece here and there's. Please note that this is a reflective tool. It's not for the management of your cancer patients. As I mentioned, you've got, once you request for the tool, you've got a search that you would then sort of run, and that would give you the list of patients who've recently been diagnosed with cancer, and by filling in the tool and entering information that are relevant to that patient's diagnosis, or even leading up to the diagnosis, such as where they were, what tests they were referred for, what was their presenting symptoms and things like that, you'd be able to identify areas that need improving within your practice, and you can then implement changes. The way the tool's been set is that you can run the search every 3 months, so you can choose to do your audit once a year, annually, or you can do it in bits every quarter, according to your patient list size or preference. Next slide, please. So as I mentioned, this is just a screenshot for how the tool looks, because I would want you to go back to our webinar recordings and have a look at how, to have a look in more detail about how the tool is used within practice. But that's how it looks overall. You've got the benefit of using the tool is that it saves you from entering patient information one by one. So things like patient's EMIS number, name, date of birth, ethnicity will all be automatically pulled in. But also, if your patient's on the housebound dementia, SMI or LD register, those codes would automatically show as well, next to the relevant patient. Anything in blue on the tool you cannot edit, so they are automated fields, but anything in white are your audit columns that you need to fill in for each patient. So things like whether at what stage was the patient diagnosed at, what tumor group they belong to, whether they've got any communication needs, and as I mentioned previously, when they first presented, what were their main presenting symptoms? Did they come to you first, or did they go to the A&E first, and things like that, so that it helps you build a picture on what you're doing well and what needs improving when it comes to your cancer referral process. Next slide, please. The second tool is the National Diabetes Prevention Programme tool, and it's part of the Healthier You NHS Diabetes Prevention Programme. It's a patient referral management tool for patients over the age of 18 with pre-diabetes results. So again, you run the search, which will pull the eligible patient cohort. All those patients should have a latest HbA1c or fasting blood glucose above normal, but not within above normal, and by importing it within the tool, you'd be able to see who has been referred, who's declined, and then who is awaiting to be referred. The benefit of using the tool is you can always export it to AccuRx for any bulk action that you may require. So if you might want to send bulk invite to your patients, and again, you can run these searches at regular intervals to see who are your new additional patients. Next slide, please. Again, this is a snapshot of what the tool looks like. We've got 2 pages. So the first page would show you your list of patients, and you've got selected filters that you can use. As I mentioned, you can choose to select, those who've been referred, those who haven't been referred. You can choose to filter by age, so those who are over the age of 65 and those under the age of 65. You can also filter by whether patients have got selected comorbidities like hypertension or CVD. And on the second page, so on the screenshot on the right, you can see detailed patient information page. So that would give you a bit more of a deeper picture of this patient's health condition without you having to go back into your patient notes. So you'll be able to see what their patient's risk factors are and what was the patient's latest HbA1c or blood glucose reading, as well as the patient's demographic details, so their telephone number and things like that. So it saves you from going back and forth in the patient's notes. Next slide, please. Third one, as I mentioned, is the renal tool that was previously known as the Falling EGFR tool. It's one of our latest. It's to help you with the CKD QOF register management in line with the CKD guidance. And by using the tool, hopefully you're able to comply better with the NICE guidelines. This tool is a disease register management tool. So again, what it does, it pulls patients with abnormal EGFR and ACR readings, and by pulling those patients in, it will help you. It's got columns that help you identify what outstanding actions need to be taken for these patients. So for example, whether they might need an onward referral, they might need a medication review. And similar to the diabetes tool, you can export it for an AccuRx function. This is what the tool looks like. Similar to the diabetes prevention tool, you can find your patients using filters. So you have selected filters such as identify those with a blood pressure reading of less than 140/90. You can also look at those with really high blood pressure. You can find patients with other comorbidities. So you can find patients with diabetes, hypertension, heart failure, or AF. And the benefit of doing so is generally clinicians like to manage patients in bits because, there are certain guidelines for different patients with different comorbidities. You can also look at patients that are on certain medications, such as those who are on the ACE inhibitors or ARBs, or patients on statin. Similarly, we've got a virtual patient review page, as you can see on your right. So you'll be able to see patients' details, and also then see the recent decline in their EGFR value. So it gives you your last 6 values. And then you can also see other clinical data like the latest blood pressure reading and henceforth. Next slide, please. This one is the last one, but it was actually one of our very initial tools. It's the Child Immunization Call and Recall tool. It is there to assist you with the vaccination and immunization QOF and helps you comply with the UK childhood immunization schedule. It's a childhood vaccination recall management tool. Again, you've got a search that you run and you import. It should give you a list of patients aged 0 to 5, and by doing so, you'd be able to identify those with incomplete sets. You can also filter by those who are due or overdue for vaccinations. And you can also filter by specific vaccinations. A benefit of doing so is, as a previous manager, I know that sometimes we might have vaccines that are coming to an end, and we'd like to quickly identify those who are eligible for that particular vaccination, and it allows you to then easily recall patients for that particular vaccine that you want to sort of get rid of. You've also got a child data page like your other previous 2 tools, so you can see contraindication and declines on the patient page. And you can also export the list in multiple formats, so you can use AccuRx again for bulk actioning. Next slide, please. So for all of our tools, we've actually set up request forms, and you might think, why is that? Our forms are very simple to fill in, but the reason why we do so is because we want to keep a tab on those who have been requesting for the tools, so that in case there is any urgent communication, we've not had to contact anybody, but in case if there is any reason that we want to contact you immediately, or let you know of anything, we then can directly email you rather than sort of putting a vague e-bulletin article that you might miss. So these are the request links. As I said, we will be sharing the webinar slides and recordings, and you can use those links to request for the tools. That would be it for myself, if there's any questions.
No questions in the chat. Does anyone have any questions? No.
No question from the.
No.
It's a wonderful presentation. I really like the presentation and the slides. Thank you.
Thank you.
That's okay.
Someone's actually asked if they can get a training on how to use the tool. Sure, just drop Billy Jo an email, and then if it's around the cancer tool, just drop me an email. But if it's around any of the other tools, feel free to drop Billy Jo an email. We will be able to provide you with assistance. So again, we can have a look at that and see why that is. It's a bit difficult to troubleshoot without actually seeing the data, but please get in touch, Hina, and we'll be happy to troubleshoot for you and find the reason why, if it is so.
Unfortunately, sometimes the macros, like they do with our dashboard, Hina, can also play around with our tools, so it's just making sure that you unblock the macros as well. But yeah, drop me an email and we can have a look at that one for you. So we're just going to move on to what we provide. We currently provide obviously support searches for your local and some of your PCNs and some QOF searches. We do templates and alerts. We do virtual face-to-face practice visits. I have recently put out in the e-bulletin about these visits, so please do contact me to book your performance visit, and I can come out and see you, or it can be done virtually. We provide quarterly, monthly and weekly dashboards on our website. and we provide our weekly e-bulletin. So any changes there currently are, or any no information we feel you need to know, is always put on the e-bulletin. This is just a screenshot of our e-bulletin for you. If you do want to be added to our mailing list, please do let me know, drop me an email, and I can add you to the mailing list for the e-bulletins. This is how you can access our CEG resources. So you've got access to our website, our CEG tools, and also our dashboards. If you don't have the login details for the dashboards, please email me and I'll be happy to send this over to you. And these are your local practice support team for all areas. So these are your first point of call, which obviously for Newham is myself. We're going to move on now for you to have your say. So what you would like from us. Obviously, we can't make any promises, but it'll be good for us to hear from you what you would actually like. So are there anyone that wants to come on? Think that you'd like from the CEG? Very quiet. Is there anything you would like, maybe like drop-in sessions, weekly drop-in sessions with myself? If you've got any queries, or 2 weekly drop-in sessions that you can pop into, would that be something that you'd be interested in?
Keep going, Charlotte, the door.
Is there anyone that would like to say of anything that they would like from the CEG?
Hi, Billy Joe.
Hiya.
Can we get an update on the current templates, just as a tidy up of current versions again?
Yeah, no, yeah, that's no problem. I mean, I can run through and show you them in a minute if no one else.
Just send them all out to everybody.
Yeah, or I send a list out to everyone and let them know what the
That'd be
updates
great,
are.
thank you.
I have emailed the ICB about the spirometry. I haven't had any reply back at the moment. Once we get a reply, I'll let everybody know. And your SNS invoicing tool will be coming out in December, and it'll be practice based, not PCM. Just so that you'll make you all updated. Is there any other questions or anything that anyone would like to see from the CEG? No, you're all very happy.
So Billy Joe, I have a question regarding the SNS invoicing tool. I thought it will be, I know it's a practice-based activity. So do the PCN manager submit the invoice, SNS invoice on behalf of the practices, or practice directly have to submit it?
Hi. With all the hassle we had last year, we've decided in the ICB that we'll leave it to the practices to submit for their part of the payment. It saves them having to wait on other practices within the PCNs, so they can actually just verify their data straight away and submit it straight away to stop holding back payment. And then there'll be an end of year invoice for the PCNs, but it'll be only purely for their monies, not any of the practices. So it'll save the PCNs having to share out invoice, then give the practices the money. This way the practices just get the money of what they've earned. Okay.
Thank you, Jen.
Okay.
Okay, it was lovely to see you all. If no one has any further questions, we can wrap up. Please do let us know if there is anything that you would like from us. And please do, I will be setting up some drop-in sessions, so you can come in if you've got any queries or any problems with templates, then I'll be setting up a weekly drop-in session that you can just come into. But it was lovely to see you all.